Today, Providence said they are close to resuming negotiations with 6 of their hospitals, but that does not include the 2 largest. That's Providence Portland and Providence St. Vincent. And instead of trying to find a compromise, this afternoon, Providence filed a complaint against a group affiliated with the Oregon Nurses Association, claiming they have not been bargaining in good faith, refusing to meet, quote, at reasonable times and reasonable intervals. The union called that, quote, categorically false in the height of irony, saying Providence is the side that consistently refused to negotiate. So the blame game is on full display just a few days into this. Nurses KGW spoke with on the picket lines this morning say a key demand is a more competitive salary, something closer to what OHSU nurses make, which is apparently around $60 per hour. One nurse on the picket line today actually crossed the line the first day of the strike, but joined fellow nurses outside after that.
So I crossed the picket line last Friday. And I realized that it's a very unsafe working condition, and I decided that I am going to defend my license instead of putting it at risk by working.
So on Friday, the first 16 minutes of our show was dedicated to talking about the first day of this historic strike. I started my day at the picket lines hearing from striking nurses and physicians. And I'll tell you, it was hard to find nurses who wanted to talk on camera. Those who did, we featured in the show. Then we caught up with a few patients leaving the hospital who had just been seen by those replacement nurses inside Providence St. Vincent. Overall, they told me it seemed like things were operating normally, albeit perhaps a little slow. Now, after getting some of that side, we talked with the chief executive of Providence, Jennifer Burrows, live on the show. And we followed that interview with a soundbite and another live interview from 2 Oregon congresswomen, both supporting the striking healthcare workers. However, that coverage sparked emails like this one from Susan. She says it would behoove you as a professional to give due justice to both points of view and talk to the ones that are affected by Providence's decisions. That would be the healthcare professionals and patients and their families inside. It is not all fine, as Ms. Burrows is trying to advertise. So I gotta say, our team was a little confused by emails like that one. And trust me, there were a lot of them, because we did get that side. In fact, we aired it before our interview with Burrows. But that live discussion with the leader of Providence didn't sit well with many of you who flooded our inbox with messages like this one from Cindy. She says Jennifer Burrows skewed truths and only delivered inflated information that she wanted to tell you and make the public believe. Angela wrote to us, "The lies management tells have gotten bigger and bolder as the years have gone on. I and many of my colleagues are on the strike line because they, particularly Jennifer Burrows, have taken those lies to the next level, and we just can't stand for it." So this war of words between Providence and the nurses union, with patients caught in the middle, continues with no end in sight. All right, so joining us live now is Gina Ottinger. She's a striking RN who worked in the emergency department at Providence St. Vincent. She is also on the bargaining team there. Gina, thanks for joining us tonight.
Yeah, thank you. I appreciate the opportunity.
Of course. So, all right, it's day 4 of the strike today. We know pay and staffing are among the top concerns. Are there other concerns that nurses like yourself have?
Yeah, I think this ultimately is about patient safety. And I think that's why nurses are speaking up. I honestly think that's why we're coming forward. And it's really hard for nurses to do this. We really just want to be at the bedside. We want to take care of our patients. And Providence has proven they're not letting us do that. And that's why you're seeing all of us come together. I think I'm really feeling moved by our providers who have joined in, because they are seeing and feeling the same things. We're seeing systemic problems, and now you have 11 units that have decided to, come together because our voice has not been heard. And that's why we are so passionate. And I'm not surprised you got a lot of feedback, because Providence likes to have the optics that they have it all under control. And we're telling you, no, they don't. They need to come back to the table and work with us so we can get a fair contract.
So where does that bargaining stand right now from the union's perspective? We know that St. Vincent is not on the list of hospitals that Providence appears ready to negotiate with.
Correct. And I think that right there saddens me the most because it really feels very insulting and disingenuous. Because if they really wanted to bargain, we'd all be there. And I think that's what we are standing for, because enough is enough. We have said, this is what we need. We need you to listen to us, and they haven't listened to us. And that's what I think every nurse wants the community to know. Your nurses are out there, not because we don't want to be at the bedside. I 100% want to go back in that hospital and be there, but I'm not going to be there until they come back to the table and start to bargain with us, or negotiate is a better word for it, I suppose.
So as we mentioned, we got so many emails from nurses both in and out of Providence after my conversation with Jennifer Burrows, the chief executive of Providence, on Friday. So we wanted to ask you about some of the claims that she made. First, the one that came up in most viewer emails was, it says, a typical acute care nurse that has been in practice for a few years makes an average of about $125,000 a year. Is that true?
I think that's a gross exaggeration. Gross exaggeration. I have a daughter who is actually a nurse at St. Vincent herself, and she does not make anywhere near that. So when you have those optics sent out to the community, it's really deceptive. I don't think that's a true fair wage that is being proposed. And when you compare us to other Portland Metro hospitals, we are still well below that. We're losing nurses all the time, not just because of the wages, which is only part of it. It's really more than that. It's about the benefits, and it's about the care we provide. We are really there and trying to provide the best care we have, but if we're not retaining nurses, then we have less nurses to provide that care, and it makes it harder for all the rest of us.
So speaking of benefits there, how about this one? Burrows said it concerns time off. She says on average, a new graduate nurse gets 23 days off a year, and on average, a 7-year nurse gets 28 days off a year. Talk about how that's misleading, if it is.
Again, I think it's more about the whole picture, and I can't give you exact numbers on that, but I can tell you we are still well below our peers in the Portland metro area. And that is why we have nurses leaving constantly. And we're always in a deficit. I still have travel nurses in the emergency department right now that are providing care and not core staff.
So talk about this new staffing law on nurse to patient ratios. I'm trying to wrap my head around this. Walk us through what that is supposed to do and why the union and Providence, you guys don't seem to agree on how to implement it.
Yeah, I mean, the staffing law, I was a huge advocate for, and I still am very, very thankful for it. It is a step in the right direction. Unfortunately, what we've experienced is the hospitals within Providence, they have really not come together to help us solve this issue. They have actually been an obstacle in it. And I've actually been very involved in the staffing committees, housewide and both on my unit. And we have things called staffing plans that really help us take care of patients so that we are paying attention to their needs and providing quality care. The hospital currently is wanting to eliminate detailed staffing plans that really articulate ratios dependent upon a patient's needs. And while the staffing law is amazing and has allowed for breaks, which is something that has been overlooked for years in nursing, it has come at the cost of increasing ratios within Providence, which has been across the board in every hospital throughout the region. Instead of understanding that we want our breaks, but we also need to have ratios for a reason, and nurses are hugely passionate about evidence-based practice. And a lot of these staffing plans have evidence-based practice in them that is supported by research that says this is how we should take care of our patients. So it's really important that we keep those plans in place and have articulated language that defines that. And right now, they're not agreeing to any of it.
Okay, well, thank you, Gina, for your time tonight. We really appreciate you coming on the show.
I thank you.
Okay, so now it's your turn. What is going through your mind? We heard from Providence last week and the nurses union tonight. Are you picking a side? Are you a patient that's feeling the effects of this strike? Let us know. Email the story at kgw.com or call and leave a voicemail 503-226-5090.